Today I will be talking about a topic that is people find it very difficult to talk about or they feel shy to talk about. That is sexually transmitted infections or sexually transmitted diseases. So, what is sexually transmitted infection? Any infection that is acquired through sexual contact is called sexually transmitted infection. And the common sexually transmitted infections that we see are like those caused by viruses like human papilloma virus infection, HIV infections, and the genital herpes. Then we have the bacterial infections also like syphilis, gonorrhea, and chlamydia. The other parasitic infections are commonly that we see is the trichomoniasis. Now, what are the symptoms of sexually transmitted infections? I will be talking about the symptoms that most commonly are seen in women having sexually transmitted infections. These include first vaginal pain or itching or burning sensation. Then they can have blisters, sores or bumps in the anal region, vaginal region, or even in the oral cavity. And then they can have foul smelling discharge, or they can have pelvic pain or pain during intercourse. These are the common symptoms. Then coming to the side effects of sexually transmitted infections. So now that we have learnt about the common infections, we need to know what are the short-term and long-term problems. See, most of the sexually transmitted infections, they go unnoticed and there is treatment so that they can be cured. But some infections like gonorrhea or syphilis or pelvic inflammatory diseases can cause long-term side effects in females, like they can lead to secondary infertility. Hence, we need to diagnose and first screen them and diagnose and treat the sexually transmitted infections. Then coming to the prevention part of sexually transmitted infections. So how do we prevent them? In the prevention part, we have the vaccines, where we have developed vaccines for human papilloma virus, and this HPV vaccine is recommended for by the WHO. It is recommended that all girls and even boys that they should be given 3 doses of the HPV vaccine by at least 12 to 14 years of age, so that this prevents the HPV vaccines and the genital warts, and which can be a precursor for the carcinoma cervixin, especially in females. Then the other vaccines we have is hepatitis B vaccine, which universally everybody needs to take it because that is also transmitted sexually. Then the other practices that can prevent sexually transmitted infections is safe sex practices, like the young adults should be given information and knowledge about the barrier contraceptives, like, and the usage of condoms or diaphragms in females. And then they should be educated about safe sex practices, like trying avoiding multiple sexual partners, or even during single partner they should avoid oral and anal sex, which will increase their risk of sexually transmitted infections. Next, coming to the treatment part, as I've already said, most of them they have treatment nowadays, including HIV. We are having treatment, so we should screen the patient and diagnose it as fast as possible and treat. Then the long-term effects can be avoided. Now, coming to the tests that are done for sexually transmitted infections. These can be in the form of swabs taken from the cervical or vaginal fluids, or blood tests, or even sometimes in ultrasonography we will be able to diagnose. Then in which situations we need to do these tests? First is to whenever the patient presents with symptoms or signs that are suspicious of sexually transmitted infections, we need to do these tests. Then again, as a screening test for all pregnant women, because some infections can be transmitted to the baby and cause abnormal effects. So we routinely screen for sexually transmitted diseases in women. And then prior to blood transfusion also, we need to do these tests. And also as an epidemiological surveillance also, we do this test. Then the other tests that are done, in the test there are various tests like physical examination, then blood tests, like there are spot tests, ELISA tests, and confirmatory tests. First we do the spot test, or the that is it will give us the whether the patient is having the infection or not, and then whenever we have suspicion, we can go for certain high-end tests which are confirmatory tests like the ELISA test. Now, lastly, I just want to tell about the common names of the common sexually transmitted infections. So, the viral infections, these include the human papillomavirus infections, HIV, and the genital herpes. In the bacterial infections, we have syphilis, gonorrhea, and chlamydia. Then the parasitic infections, we have trichomoniasis. So, we can conclude that these sexually transmitted infections can be prevented by taking proper vaccines, by practicing safe sex practices, and by giving sex education to all the young adults, and in pregnancy especially screening them so that we will avoid transmitting the infection to the baby. Thank you.